A very good morning and welcome to the 2020 National Conference for Clinical Research. My name is Dr. Goh Pik Pin. I am the Director of Institute for Clinical Research. I'm very glad to introduce you the lecturer for the CRC NIM lecture, who is no other than our Tan Sri Dato Sri Dr. Noor Hisham. Tan Sri DG has been our Director General of Health for the last from 2013. He is also a senior consultant surgeon in breast and endocrine surgery. Besides that, at this COVID-19 pandemic, Tan Sri DG lead the Ministry of Health team together with other agencies and ministry in the successful battling against COVID-19. And DG always said we work for the nation and the battle is not yet over. We would like also to congratulate our Tan Sri DG for his recent distinguished award, which is an award given by the Yang di-Pertuan Agong, which is carry the title Panglima Setia Mahkota, which carry the title of Tan Sri, and also the recent award on the National Tokoh Ma'af Hijrah. Besides that, our Tan Sri DG also have received the Most Outstanding Brand Leadership Award. Congratulations, Tan Sri DG. The time is yours. We would like to welcome you to give the CRC NIM lecture.
All right, thank you very much, Dr. Goh. First and foremost, I would like to welcome everyone to this webinar, and hopefully we can share some experience battling against COVID-19. I think we are living in a very challenging time, and this is perhaps a lifetime experience for all of us. And we need to look into both sides in terms of our services and how can we improve our services further, and how can we prepare for the next crisis, for example. And never in our wildest dream that we will face this virus in our lifetime. But today, I think just the global trend of COVID-19 infection with the confirmed cases is 23.1 million and affecting 188 countries. And the death rate has actually increased to almost more than 800,000 death globally. And next slide, we look into the scenario of the 188 countries. The first situation, when we look into the first situation, it is actually provided by a large outbreak, but the strong leadership and the country managed to control the infection. And this is obviously the best we can see. Whereby first situation is the countries were able to prepare well, respond well, and you can see the good outcome. Now, we in Malaysia, perhaps we are in the second situation, and we have a surge of cases from March 31st until the peak in 16 or mid-April, and we did certain, we won certain battle. For example, battle of the battle of the MCO, battle of the CMCO, and now we are at the phase of RMCO. But the war is not been won yet, and this is where I think we managed to control, flatten the curve, and control the cases. We still see cases every day, double-digit, lower double-digit, and even single-digit. We hope that the next couple of weeks we can control it better. And the third situation, we have seen this now, and we must learn from this from other countries like Australia, New Zealand, lately Korea. And I've been informed in Korea, for example, the second wave they are seeing, yesterday they have 397 cases. They have 2,600 cases within 10 days now. So they are increasing, they are facing the second wave in Korea. So they managed it very well in the first wave, and they managed to control the cases. Now, I think we have seen countries like Hong Kong, Japan, Australia, Spain, Italy is all facing the third situation. And the last situation is the fourth situation. We are seeing this in India, we are seeing this in Brazil, we are seeing this in US. The cases keep going up. They are not in the recovery phase, but acceleration phase. So this is the fear that globally, 23 million people, more than 23 million people have been infected, and death is more than 800,000. So it is very important for us to control our border. That is number one. Second is that the local transmission. So we need to prepare ourselves for the worst and then hope for the best to control this infection. I think the war is not over yet, although we have won some battle, but the war is not over yet. Next. Now, you look into the distribution of the COVID-19 detected in Malaysia. We were in the peak at the mid-April. That's where I think we managed to convince the Prime Minister to implement the MCO. And this is not easy for a Prime Minister to implement because you know, the cost of implementation of MCO is about 2.4 billion ringgit a day. So, but we have managed to implement the MCO 1, 2, 3, and 4 every 2 weeks instead of making an announcement 6 weeks or 8 weeks. But this is a mind conditioning of the public to accept every 2 weeks and then they move on to every 2 weeks. So MCO 1, MCO 2, the intention was to flatten the curve. And we can see when we reach MCO 3, we managed to, we already almost managed to flatten the curve and in the recovery phase. Then we move on to MCO 4 for a very short period of time. And because of the cost, then we have to change our strategy to CMCO. CMCO is to allow the economic sector to function back and resume operation, but follow the SOP. And but still restrictions being given to the social sector, the education sector, and etc. So when during the CMCO, we were in the fasting month and the celebration of Hari Raya, and you can see the two peaks. The two peaks are mainly local cases that is actually from foreign migrants, but in contained environment in the Depo Tahanan immigration, in the immigration confined center, detention center. So during the CMCO, we managed to bring down the cases further, and there was no spike of cases after Hari Raya. That's credit to our team, who is actually looking into all the frontliners and also the police, for example, implementing the roadblocks, interstate travel, etc. So now we are using the whole government and whole society approach. In the past, we have used this Act 342 mainly for in the Ministry of Health, but today we live the day to see, you know, every sector is a health sector, and whereby we work closely with other agencies, and we also have authorized other agencies to enforce some of the measures that have been taken. So this is some success story that we have managed to win a few battles: the battle of MCO, the battle of CMCO. Now we are in the at the phase of RMCO, recovery MCO, and you can see we managed to contain the infection, lower single digit and lower double digit. So over the last 6 weeks, you can see, but initially it's much better. You look into the graph. Initially, our performance much better. Then you know, success breeds complacency, and when a lot of people flouting the SOP, then you see cases going up again. And hopefully now we have addressed that. We are bringing down the cases. We started with the R0 of 3.55 before the implementation of MCO, which means one person will infect 3.55 people, and which means 100 people will infect 355 people, and that continued to spread. And we managed to bring down the R0 to 0.33, and that means 0.33, one person will infect 0.33 people. That means if you have 100 people infected, then it comes down to 33 people. And 33 people, you go down, the cases are becoming less and well controlled. And now we are at the R0 of 0.78. This is why we need to you know, enhance further our action plan to bring down the cases to single digit, for example, if possible. Next. Now, our approach initially, this is a whole government and whole society approach. We started in the Ministry of Health, no doubt about that. We are taking the lead now for the government, and we anticipated this infection in December 2019. Instead, in denial, but what we did is we prepared in terms of, we activated our CPRC, we activated our lab, and then we looked into how can we actually diagnose this virus if we you know, in just a matter of time, the virus will reach our shore. So we prepared our lab well, and the moment on the 3rd of January, China released the genomic sequence, our lab using RT-PCRs already ready to do the testing, and then we start training our labs in the public sector and private sector. So that was the first Second is that we look into our surveillance and public health intervention. So we reactivated the CPRC, national and state, and then we revise and train in terms of active case detection. And then we look into the surveillance of the Seri, ID, and pre-operative cases. And we adopted this approach, targeted approach. That we mean, rather than carpet bombing, we look into the locality. If the locality is in high risk, or we look into the groups, high-risk groups, and then we continue to, although we started with MCO is important for us. It's only a platform, but not the solution. Meaning in the artificial environment, the MCO is artificial environment, everybody stay at home. Then the public health intervention comes in to do the contact tracing and deploy our staff to act on certain localities and certain high-risk groups. In the MCO, we also have the EMCO, Enhanced Movement Control Order for the high-risk localities and also cluster group. And then the targeted EMCO for the cluster, certain cluster. And these are so small, minor battles that we have actually. Once we come in and lock down in EMCO, we provide the food, there's no movement at all, and we screen everybody in that locality, whether they are local or they are foreigners, and we provide food. EMCO or semi-EMCO or TEMCO, TMCO is basically, we still allow movement in terms of providing, in terms of buying their food and etc. But more importantly, we control the environment and we test everyone. So, and our strategy is that we always use evidence-based, and this evidence continue to evolve over a period of time. That means 6 months. This is a new virus. We do not have knowledge about this virus. Every now and then, every day brings new lesson and knowledge for us to adapt and also to react once we know the behavior of the virus. So we continue to have the treatment protocols, the modeling projection, the health technology assessment in certain innovation, looking into the national mortality review, clinical trials are ongoing after. And more importantly is that when we talk to the public, it's based on facts, not fear. When we talk to the public, it's based on science, not rumors. And it's more important is the unity in terms of the whole government comes together and also the whole society comes together. So risk communication is very important for us to engage with the public and then to explain issues and challenges and also create expectation of the public. And then we deliver beyond that expectation to control the fear. If the public understands the subject matter well, the fear is less. So this is why the Prime Minister has identified 2 spokespersons for the risk communication. One for non-medical is by the Minister of Defense, and the medical, myself, is doing it every day without fail. So we engage in all issues and challenges there. So this engagement, and we deliver beyond the expectation of the public, so we win the public trust. And once we win the public trust, this is why the information that we want our public to comply to the SOP, etc. The war will never be won if the public is not on board. So this is important, and our strategy is protect the vulnerable and make sure that the public is aware and that public empowerment in terms of the implementation. So isolation and our system now, if you have a positive case, for example, although asymptomatic or mild symptom, we will definitely admit to our center, our hospital. And if it's Malaysian returnees coming back from overseas, we make sure that we quarantine them either at home or in a quarantine center. So these are some of the implementation that is actually mainly been done in Malaysia, but not many countries are doing it, which means positive cases in other countries, they are being isolated at home. But here we isolate them in the hospital, make sure that we contain them because the infectivity is very high at that period of time. So we need to contain them. And we identified preparedness apart from public health and the lab. So we upgrade our lab in terms of the reach out in many hospitals and in the States, as well as we look into our facilities to enhance our facilities. Our facilities already congested before COVID, but we created 7 hospitals only for COVID. And then we use the cluster hospital to decant some of the patient or non-COVID patient and lock, stock and barrel the services to the district hospital. So I think this is how we managed to open up a space, and we created our MyIMS temporary hospital within 4 days, for example. That's to cater for our patient. Now we are using Sungai Buloh Hospital, Pusat Kusta Negara, as a quarantine center, and hopefully that we can have enough space to cater for our patient. Next. And at the moment, you look into the total individual sample in our country is 1.17 million, and the positive rate is only 0.79%. Case fatality is one of the best, 1.35. Recovery rate is 96.68%. This is the latest. And our active cases today is 1.97. We have 183 active cases, a positive patient in our hospital. ICU, 9 patients in ICU, 4 ventilators. So meaning that we are able to control the situation at the moment. So looking into our positive rate, there's actually a question whether we are testing enough. Now, next slide. So you look into the next slide now. We are testing 35.6 tests per 1,000 population, and our positive rate is only 0.79%. Korea is testing 33 tests per 1,000 population. The positive rate is 1%. So if the more tests you do, and if the positive rate is high, that means you have to do more. For example, in the United States, they are doing more tests than us, 210 tests per 1,000 population, but their positive rate is 7.9%. And you look at Singapore, our neighbors, they are doing 125 tests per 1,000 population. Their positive rate is 7.6. Now, the WHO came up with a statement that if you will detect more positive patients, for example, that means 10%, 15%, very high, that means there are more patients out there not being tested, not being detected. So looking into our sampling now, the most accurate sampling is pre-operative cases. We have done more than 100,000 pre-op cases, regardless, whether they're rich or poor, they're urban or rural patient. But we sample them before surgery. Our pickup rate is only 0.05%. And this is, and our surveillance from ID as well as Seri is also very, very low, lower than 0.79%. So which means in Malaysia, I think the infection is well contained. And you look into our hospital beds, utilization is very low now. Our ICU beds, ventilation is only 4 patients, but we have 1,364 ventilators, ready for COVID patients. So I think this is why we look into the comparison, because there's a notion that we are under testing. We say we are not, because looking into our data comparable with other countries, this is not from me, this is from the Oxford Martin School. There's a world data that actually they collect the information and share the information. So this is a very important slide, meaning that we are doing well now, but the war is not over yet. Next. So this 16 March is a historic moment for the public health, whereby the movement control order under the Act 342, that is the Prevention and Control of Infectious Diseases, drafted in 1988. This is where the government has implemented Act 342 for the whole country, and never before seen in the history of Malaysia to use Act 342 for the whole country. And every ministry, is actually coming together. So we have meeting every day to coordinate our implementation. So from 8 o'clock to 9 o'clock, we have an internal in the Ministry of Health meeting in terms of looking into issues and challenges from the lab until the hospital, and all issues will be discussed. And then 9 o'clock, I will always be the first presenter in intergovernment meeting, and whereby we coordinate our efforts together. And so then 3 times a week, we have to brief the Prime Minister until 1 o'clock. And then after 1, we have to rush back to crunch the data for the day. Every day we have a press conference then to actually inform the public the latest and current situation. Next. And the joint external evaluation before the COVID, I think there are already a few external evaluation on our public health response, and our public health response is one of the best in Asia. If I'm not mistaken, is the 3rd in Asia, as well as been named as Preparedness under 18 in the world. Our experience in the past, for example, handling SARS, handling MERS-CoV and H1N1 have given us the experience and the organization and the setup in CPRC. But that is actually a smaller scale. Now we are looking into a larger upscale of the preparedness, not only involving Ministry of Health, but also involving other ministry and under the National Security Council. Next. So Malaysia Preparedness and Planning began in 2019. You can see our preparedness, the guidelines, and we continue to evolve our guidelines until the 5th edition, because with the current knowledge keep evolving. So, and with preparedness in terms of equipment, preparedness in terms of facilities and all. So this is a whole government coming together, and Ministry of Health, also has strengthened in terms of our border. Make sure that we can control it much better. Next. And MOH Crisis Preparedness and Response Center has been recognized locally, and even the King and Queen came and visited the National CPRC. The Prime Minister visited the National CPRC, and also we activated hospital services CPRC, state CPRC, and hospital operational room. So the coordination is important because data have to flow. But the shortfall is that in terms of preparation, our digital preparation is lacking behind, because only when the crisis, then only we started exploring in new apps, new system, and etc. We should have prepared the digital information and coordination system before even the crisis. I hope that in future we have all these apps and all the coordination system by system already in place, not during that time. It must be a proactive rather than reactive. Next. So our COVID-19 hospital and lab preparedness as of 24 August, you can see we have 120 screening hospital, 7 quarantine and treatment centers with 2,100 beds, and our capacity in our lab from 1,000 lab per day, tests per day, we are able to do 38,236 tests per day now. So our capacity has increased, and our current bed capacity for total COVID is 3,728. So it's very important for us to contain the infection. If we get, for example, 1,000 cases a day for the next 4 days or 5 days, our hospital will be congested. And this is why we need to mitigate and control as best as we could. And as I said, it is like a burning ember. I told the PM it's a burning ember. And this is the best time, a small window of opportunity for us to contain the infection. If it's already turning out to be a wildfire, it's very difficult for us to control. How can you, for example, contact tracing 1,000 or 2,000 cases a day, for example? So this is the challenges that we have. So, we took the opportunity and we managed to flatten the curve and control the situation. And we need to maintain that situation. This is the greatest challenge that we have, because the war is not over yet. And we see other countries, in terms of they are getting second wave and third wave, that is actually worse than the first wave. Next. And you look into the cases, the level of preparedness of all COVID hospitals, we managed to bring down the cases, and the number and utilization of COVID beds also came down. And we hope that we can maintain and contain and maintain the current situation. Next. And this is the MAIPS Quarantine and Low Risk Treatment Center. So we admit those patients asymptomatic mild symptom in this hospital that we created within 4 days. And we can accommodate approximately 604 patients, and we can expand the beds into 1,000. So we have the knowledge, we have the know-how. If needed be, we can always start back again the quarantine center. But our cases has been single digit and double digit for the last 2 months. So we hope that we can contain this infection and continue to do what we do best. Next. And the humanitarian aid mission, I think coming together, this is not only Ministry of Health, but all agencies comes together and to bring back the Malaysians, for example, from overseas, and make sure that we quarantine them. And this is some of the services that we have provided, the government have provided for the people. Next. And as I said, we have this Psychosocial. This app was created during the crisis, and we have 8 modules more importantly, the modules help us in terms of protect the confidentiality of our patient. So, you use this barcode, for example, scanning, and if needed be, we can actually break the code and then to identify who came to the restaurant and etc. So to date, 16.7 million users for MySejahtera, and we hope that this software will have other features as well, enhance it from time to time in terms of the assessment of the risk, casual contact, close contact, person under surveillance, person under investigation, and confirmed cases. So this app is very useful, and we hope that all Malaysians will download this app. Next. And the MySejahtera dashboard will give us the indication in terms of the registration and confidentiality. So the information is confidential. It's not owned by the company, but it's owned by the Ministry of Health. This is the apps owned by the Ministry of Health. So confidentiality being assured. Next. And enhancing the data collection and reporting. This is why we need ICT in terms to facilitate the migration of previous lab data, integration work, active participation of the PKD and the state's PKN, whereby there is actually using now teleconferencing facilities and all. So this is why we need to enhance our digital development for data collection. So data flow freely from district into the center, but more importantly from the private to the public as well. So we are looking into the whole nation integration of the data. Next. And the protecting of our health workers, that is our first priority, because the highest risk group now we look into it is healthcare workers as well as the family members. So we need to protect our healthcare workers in terms of pre-exposure, for example, post-exposure, communication, the do's and don'ts. And so far, I think I'm happy to say that we have actually done the tests for healthcare workers in Sungai Buloh Hospital, and none of our healthcare workers, more than 480 healthcare workers, been screened for antibody. None of them have antibody towards COVID-19, which means they have not been exposed. So in other words, the most safest place in Malaysia is actually in the COVID ward and COVID and ICU ward. So because the infection rate is very low, why? Because protection been given to our healthcare workers. So this is important. 80% of our infection in our healthcare workers contracted the infection from the community, and again 20% from the patient and etc. So I think we must be always be vigilant in terms of protecting ourselves. Next. Mental health, and this is also very important, mental health and psychosocial support services, not only for our patients, but our public, but also for our healthcare workers. So we have services provided online, and then we can actually look into these services to calm them. And for the public, for example, to stay indoor, for example, for 3 months is very challenging for them. But we provide these services to calm them down and then to disseminate information, etc. Social compliance and social responsibility. This is the most important because there are 6 criteria we are looking at. Social compliance in terms of the SOP. If the public is not on board with us, not complying with the SOP, then that is the beginning of the end. So to win this war, we need the public to comply with SOP in terms of the social distancing and wearing a mask. Now we have evidence to show physical distancing. Initially it was social distancing because everybody stay at home, but now it's a physical distancing. And physical distancing and wearing a mask, we can actually cut the infection or stop the infection at least 65 to 70%. So this is something that we can actually embrace and practice to mitigate the risk, and continue to have hand washing, for example, and advise the public to stay away from crowded places and confined spaces. With confined spaces with poor ventilation, there is another big risk of infection. So these are some of the advice that we continue to daily informing the public to comply. And if they comply, I think we can actually cut the infection. Next. So this is a balance now in terms of looking into the virus as well as the livelihood, life and livelihood, the virus and economy. How do we balance this? And we can actually, the best approach will be MCO, which means everybody stay at home. But then that's not livelihood in terms of economic sector will be, will be disrupted. So what is more important is to allow the public back to the normal activities and economy, social, education, and etc. But control the infection. But they must comply to the SOP. Next. So, and the WHO has mentioned this, and the year of WHO mentioned financing the health response is therefore an essential investment. So we hope that in future, the government will continue to invest in health. Health is actually wealth now, and every sector is a health sector. Today we are seeing, in reality, every sector is a health sector. The three main areas of focus is to ensure that core public health measures are fully funded, to strengthen the foundation of health system, and to remove the financial barrier to care. So I think these are some of the strategies that we need to embrace and to learn from this lesson. Next. And looking at the World Bank, 150 countries are affected and disrupted with this COVID-19. And this is why I think Malaysia economy projected to contract 3.1%, and the impact of economic disruption during the MCO. So we need to balance this in terms of now we hope that the economy is expected to rebound in 2021 with a growth of 6.9%. So we work closely with Ministry of Finance to look into the balance between life and livelihood. Next. And on the 4th of May 2020, we started easing the restriction by allowing most businesses to reopen under the conditional movement control order. So we have won the battle of MCO, and we started the CMCO on the 4th of May. And we won the battle of CMCO because we managed to control the infection. Then we move on to Recovery Movement Control Order, RMCO, which took effect on the 10th of June, lifting most restriction on domestic activities and movement. So we allow livelihood to resume back, provided the caveat is that they need to comply to the SOP. So we have created the SOP for many sectors, and hopefully they comply and we control the infection. So to allow livelihood, life and livelihood. Next is that the border remain closed, and overseas travel restriction must also comply to some of the measures being taken. So we hope that we are able to contain the infection and make sure we also tightening our border control. Not only the official border entrance, but also the illegal entrance now. So the police is actually monitoring the situation locally, and the army is actually helping us to tighten our illegal entrance, and the immigration comes along in terms of the legal entrance to our country. Next. So in conclusion, working together to combat the spread of COVID-19, the whole government and the whole society approach is very important, the leadership. So I always emphasize this, the current leadership listens to Ministry of Health and also trust the civil servant. Can you imagine other countries where the leadership is not listening to the technocrats, for example? So we see the outcome from this, and continue to strengthen our preparedness and response capacity. So we always look into how we can improve further and collectively make a decision. Enhance late containment phase, maximize suppression of disease transmission, early detection to detect the clusters, and also to react fast in terms of trace and track the locality as well as the targeted group. And behavior modification. So we want the public to come on board to have to embrace the new norm. And also we need to revitalize the economy using, for example, teleconferencing, food deliveries, and etc. And continue to strengthen the health system capabilities and the digital readiness. And last but not least is to continue to strengthen the multi-sectoral, regional and international collaboration and coordination in terms of the vaccine research, in terms of our neighbors. How can we have a mutual reciprocal SOP for them to, for our neighbors to come into our countries. So this is something that we need to fight this war together in unity and solidarity. We flatten the curve. So it is important for us now as healthcare workers to continue our effort. The war is not over yet. Our fear is the second or even third wave coming into our country. We have seen this in other countries, but we have yet to see this in our country, but it's not impossible. So we need to prepare for the worst and we hope for the best. I think that's about all from my presentation, and thank you very much.
Thanks, DG, for the comprehensive account and very updated information to all of us. There are about 750 participants in this conference. I'm sure many of them are healthcare workers, and we will abide by your advice, and we wish everyone all the best in this battling against COVID-19. Thank you very much.